name's Alexia and I will be doing my video for the Supervision Skills assignment. So the first question is, what are the main differences in the roles of an OTR and a CODA? Essentially, there is a bit of difference in the way practice is done. So an OTR does all the evaluations, they make all the clinical decisions, and they design the treatment plan. While they also supervise the CODA, because the CODA is the one that follows through with the intervention plan on more hands-on with patients. The CODA is also allowed to make opinions, provide feedback throughout the intervention, and they can also take some notes. But at the end of the day, the OTR is the main one that follows through and reports all documentation, and they sign off on documentation. I do feel prepared to be a supervisor. However, I do think about the times where I'm a new graduate OT and I have to work with a CODA that probably has 10 to 15 years of experience. I think there's going to feel like there's a little bit of an imbalance there. However, I could just use that to my advantage and probably ask for some helpful hints since they've been in the field for a while. How they work together. So it's more of a team, so it has to be collaborative. There has to be always communication, regular communication, discussing the client progress, how the intervention's going, should they modify, the quality of care, how the patient is reacting, is it being beneficial, what does the patient give in terms of feedback. And like I said, the clear line between the job duties is, like I mentioned earlier, the OTR is the one that signs off on all documentation. They provide all feedbacks, so that's a little bit of a difference. While the CODA is more hands-on and does the intervention. So there is a little bit of difference in practice. What does it mean to supervise a CODA and implications for protecting your license? So when you supervise a CODA, you are essentially gonna guide them, support them in the follow-through for the patient intervention. So there always has to be consistent communication, like I said earlier, and you have to monitor the patient at all times, ensuring that there is someone with the patient at all times. Also just providing feedback for professional growth and the overall quality of life for the patient. We want to deliver the best care possible. But implications for protecting my license. So with that, I'm going to always follow my state's occupational therapy laws and regulations. I have to ensure that I have enough and appropriate supervision of my CODA. So that means I'm signing off on documentation that is correct. I'm following all the ethical procedures, and I'm practicing within my scope of practice and following through with my professional responsibilities. On top of that, I'm meeting professional standards, knowing that, hey, my CODA cannot do this, they cannot perform an eval, I have to be the one that does that as the OT. What is the other one is, what does your state laws and rules say about supervision? So with that being said, you have to limit the CODA practice. So in the state of Texas, you have to be responsible, and you're responsible for the CODA as the supervising OT. You have to document all supervision, and you have to document all treatment for the patient. There has to be consistent communication. I think that's a big one. I've said it multiple times. The state of Texas does require all that. It requires renewal of our license, both for the OTR and the CODA. And then the last one is, how do you plan to protect your license? So with that being said, I want to clearly define the roles and expectations. So I really want to stay within my scope of practice. I want to ensure that my CODA stays within the scope of practice. I want to ensure that my CODA is doing the right thing and following ethical procedures, because at the end of the day, I'm also liable for that CODA. So when I sign off, I'm saying we are together and this is in conjunction and I approve this and I think this is correct. So I do want to review all documentation at all times. I want to ensure that the treatment is being delivered, and that's probably going to be me supervising my CODA at times, coming up in the sessions and hey, I'm just going to watch you, nothing here. I do want to ensure that my client is demonstrating positive progress, and that's also how I plan to protect my license. So just knowing that I'm communicating to the CODA, this is what you need to do, this is your scope of practice, don't stray from it, and then also just staying compliant with all state regulations and regulations and professional standards and requirements for my practice as an OT. Thank you.